duration and the complication will determine how that is coded. The patient might just have a reaction or a complication that's unrelated to that original injury, and we would code that separately. If patients are having pain due to their medical devices, we do have a different set of codes in ICD-10 to clarify what that injury is or what that pain is. We also have codes for chronic pain due to the presence of those sorts of devices or implants or grafts. So if patients are coming back months or years later with pain associated with, let's say, rods or pins or screws that have been placed from a fracture repair, we have a injury T code to help describe that, along with the chronic pain due to that implant. So the next thing we're going to talk about is going through some of the external cause codes and the additional information you may have your coding staff asking you for when ICD-10 starts. So these codes are intended to provide data for injury research and evaluation of injury prevention strategies. We know that these codes are really used by our insurance companies to determine whether someone else is liable or not. So if I get hurt in a car accident, chances are my health care insurance doesn't want to pay for it. They want my motor vehicle insurance to pay for it. Or if I get hurt on the job, then workers' comp needs to pay for it, not my health insurance. So that's really one of the main focuses here in the U.S., why we're using these external causes. These codes are always secondary, so they would never be our primary diagnosis. And we're going to use these codes to capture how the injury happened, the intent, so what was the patient trying to do, and then where did it occur. We have a lot of codes for all of these, what the patient was doing, what they were trying to do, and where it happened. So really what this comes down to from an audit perspective or a coding perspective is really looking at our HPI and getting a good story from the patient of what they were doing and where they were doing it that led to the injury. We know that we can't always capture that. The patients don't always know or don't remember, especially if there's a head injury or in the elderly. They might have come in for pain and don't recall falling or don't recall an injury but now have a fracture. So as long as we can capture in our documentation what we can and explain why we can't get more. So, for example, if you see a patient who's unconscious and no one else was there to witness a fall or an event, it's going to be very hard to find out what they were doing and when they were doing it that led to a fracture. But our notes should reflect that the patient's unconscious or there was no one there, or that we're unsure what led to this injury. And there are some kind of generic codes for those sorts of scenarios. What we want to do ultimately is try to not delay payment of our claims. So if we have a claim with an injury diagnosis go out without any of the other codes that explain what the patient was doing or where they were, chances are the payer will hold the claim and try to send a report or a form to the patient and they'll wait to pay you until that patient has responded with information about how and when they got hurt. So if we can do that on the front end and supply that information to the payer with codes, chances are our claims won't get held up and it won't hold up our payments. So these codes for external causes can be used with any code within the ICD-10. They're most applicable for our injuries, but there's also external cause codes for some of the infection codes and when patients have heart attacks. We're going to use these at each encounter that the injury is treated. And then we are really just trying to paint that story of how, where, and why this injury happened. So the Chapter 20 is kind of broken out into 3 different categories. The external cause, so what happened that caused this injury, like I fell off the ladder. There are codes out there, and the example there, code T36. Poisonings by penicillins, that's accidental. We wouldn't have to report anything else because we know that the patient got poisoned, we know that it was an accident, and then that it was by a penicillin. So there are no further external cause codes to report for that one code. Place of occurrence would always be secondary, and this is where was the patient when this happened. So they were in their single-family home, they were in a motor vehicle or on a highway. There are quite a lot of place of occurrence codes basically any type of residence, single-family, multifamily, apartments, condos, campsites, down to their activity. What were they trying to do? So they were trying to do maintenance, they were gardening, they were rollerblading. So we kind of paint this picture of what caused it. They fell on the street, and they fell while rollerblading. And so we're using multiple codes to try to tell that story in codes. So when multiple external causes, we're going to sequence things. For child or adult abuse would always be coded over any other type of external cause code, as would terrorism, cataclysmic events, transport accidents, or activities and status codes follow all casual codes. So it's very, we've done a lot of reviewing of medical records and coding them into ICD-10 just to get a feel for if we have proper documentation or if we find any gaps in our documentation today. We really haven't come across a lot of cases where patients are coming in with multiple external causes. I think the only one I remember seeing from an actual chart was someone who got into a car accident, got out of the car, and then was struck by something else. And so there was kind of multiple events that led to the series of injuries that the patient had. Abuse, neglect, and maltreatment are classified as assault in ICD-10. So there are some ICD-9 codes that kind of take out abuse from things like child neglect. And now in ICD-10, everything is considered an assault from a coding perspective. Unknown or undetermined, we're going to code as accidental. So if we don't know why something happened, some sort of injury or overdose or something that may be self-inflicted, it will always be coded as accidental unless it's defined as not accidental or intentional. For late effects, that's where our 7th character S for sequela comes in. We would never report the side effect with a current injury code, so we wouldn't see the injury getting active initial treatment and being treated for a side effect at the same encounter. That wouldn't make sense. We're using this for subsequent visits when we know that this late effect or the initial injury is being treated, not just follow-up care if no late effect's been documented. So the next few slides are going to walk through some examples. What may be helpful, may not be helpful, just depending on the flow of your office, will be to look at some of these after the webinar tonight and kind of look at the coding book, see how you would find these codes, or see how you would find these codes within your EHR or coding system to kind of get a feel for how your current documentation flow will work once this change has been made. So a 46-year-old male working on his own home fell from a ladder. After evaluation, he has a non-displaced femoral neck fracture on his left leg, no surgery planned. They want to know what kind of codes we're going to see for this. So we know that we're going to start with a code for the fracture itself, and then the rest of our codes are really going to be painting the story of what was the patient doing that led to this injury. So our first code here, fracture traumatic of the femur femoral neck, S72.002A. So that A is because this is our initial encounter. The next code that we're going to report is what caused this injury. And in this case, he fell off a ladder. So there's the code for falling off the ladder. You'll notice this code also has a 7th character for that encounter type. So this is an initial encounter, and that's why we see that A present. Next, we want to tell whoever's looking where this injury happened. So this patient was at home, and so we're going to pull up that the patient was in a house single-family residence. The last code that we're going to report is what was the patient, kind of their status when this injury happened. And this category is new for ICD-10, this idea of using this. We basically have 5 codes within this section that We report what the patient's intent was during the injury, which was that they were trying to do property maintenance, that Y93.H9. And then the fifth and last code is Y99.8. And this category Y99 is what's new for ICD-10. This is basically telling whoever's looking at our claims, was the patient working or not when this happened? So we have a code for if this was a civilian activity done for income or pay, so obviously any of our workers' comp type claims. We have codes whether this is a military activity, a volunteer activity, or other. And most of your injuries, if they happen outside of work, will be this other code, this 99.8. Basically, so if you're doing something, it's a hobby, leisure, off-duty, not working, as a student, any of those are going to fall to this category. Looking at our next example, a patient fell from a ladder in the garage 4 weeks ago while working on replacing a garage door switch. Injury resulted in fractures of L1 and L2 vertebral bodies, and is receiving physical therapy for this routine healing injury. So, during our PT encounters, we will be billing code S32.019D. This is the fracture of the L1. And then there's our code for L2. The reason you'll see that 7th character is a D is because this is a subsequent encounter for routine healing. The last code we'll code on this case is the external cause, which was falling from that ladder. And again, you'll notice that 7th character is D. The place of occurrence and status, external cause status codes, so those Y codes that explain that the patient was doing routine maintenance in their single-family home while doing non-work activities, those codes only get reported on the initial encounter. So only the first time the patient is seen for a problem, whether that's in your office or at the ER, that's the only time those codes need to be reported. I will caution that that is how the codes are intended to be used. We know that our payers may come up with their own rules or own processes for coding, so it may be that some payers, in particular workers' comp, might want those codes on every claim. And we'll just have to wait till we get a little closer to go live to see which payers may be requesting things like that. So again, the rationale here, the one that's kind of important is explaining to you why all those Y codes weren't required. They're only used on the initial encounter, and no external cause codes assigned because the coding guidelines state that Y99.9, which is unspecified, should not be used on a subsequent encounter. So if we don't know, they don't want you to use the unspecified. They want you to just leave it off. It may be that delays payment, but chances are, unless it's a workers' comp claim, they're not going to be looking for that piece of information. If you've already told them that they were at home during maintenance, doing maintenance on their own home, that's going to be enough for them to determine that they weren't on the job.